and they're excited to have you engage. So when it comes to the point where, you know, they're asking for you to participate and ask questions, you will get more out of it the more you put into it. So make sure that you talk and are friendly and ask questions, because you're going to have an opportunity to speak with them where you wouldn't necessarily have that opportunity, you know, to ask them some in-depth questions. So seize the day, ask away, and take notes. Pay attention. Okay.
Awesome.
This is Tony Rockwell.
Hi, it's nice to meet you guys. Thank you guys for coming. It means a lot to us. Jessica is our Chief Nursing Officer at our hospital in Brownwood. I'm going to let her kind of start most of the presentation, and then there at the end, I'll kind of tell you a little bit about what I do in our department. Are you good to click through it, or do you need some help?
Okay. Perfect. So very informal, so don't feel like this is a formal setting. If you have a question, just raise your hand. I am a nurse by background, and so naturally that's where I lean towards, and so a lot of this is geared towards nursing, but I did want to kind of get an idea of where y'all's majors lie. Are y'all all healthcare? We have some business, nursing, public health, that's fun. Nursing, business. You can shift to nursing, right? Y'all?
Nursing. Mine's psychology.
And I'm kinesiology.
Theology, okay.
Biology.
Okay. You want to do pre-med?
PA school.
PA school. Okay, good. Still medical. Okay. Like Tony mentioned, really this is beyond what y'all are learning in the textbook. This is really just talking about your transition into the professional workplace, what that looks like from a teamwork perspective, career readiness, preparing to go, as I have it, into the healthcare system. Tarleton will prepare you with all of the book knowledge that you need. This is really the things that you already have within you, the things that we can't teach you, that you will come out in your career. I did have an intro slide. I will talk just a little quickly about me and my career. Do you want to talk about yours for a second right now? I have been with Hendrick Health for almost 18 years. Most of that time was in the Abilene market. I started as what is now the Nurse Tech program. My summer before my senior year in college, I went through a BSN program, bachelor's program, and started out there and was going to be there short term, fell in love with the mission and the culture and what we were doing. And then we acquired the hospital in Brownwood. So I moved there about 3.5 years ago, and now I serve as the Chief Nursing Officer for our hospital there. A little bit about Hendrick. We are a faith-based, not-for-profit. We have been around for 101 years. We serve 9% of the land mass of Texas, which is huge. So 24 counties fall into our service range, with our 3 campuses that we have, 2 in Abilene and the 1 in Brownwood. Share yours, or you want to wait?
So my name's Tony. I actually am the Director of Workforce Development. So my job is to create a pipeline of people into healthcare roles, and obviously, hopefully, into Hendrick. And so we get to do a lot of really fun things. I'll tell you a lot about that. I'm there kind of towards the end, but basically we do a lot of education and then tuition assistance and things. I actually was a psychology major. I went to school, got my master's, thinking that I wanted to be a therapist. And we had a whole section on adolescent psychology and what you would do if someone was thinking about taking their life and then did so. And I was like, I'm out. Thanks for playing. And so I really transitioned more into nonprofit. So I worked in nonprofits pretty much my whole career. I was the executive director of one for about 15, 16 years. And when it was time to transition, I will tell y'all, never in a million years did I think I would work in healthcare. I don't do bodily fluids. My kids throw up and I'm like, take some Clorox wipes and go sit in the bathroom. I'll see you when you're done. I'm just not that person. But getting into this has been really exciting, because really what I love to do is help people figure out what they want to be and how to get there. And so that part's really fun for me. I've been at Hendrick, it'll be 3 years in March. And so it's been really fun. I actually knew Jessica from my last job and took care of her kids in one of our after school programs. And so it's been a lot of fun to connect with people. We have about 5,600 employees, a little bit more. And so you think that you know everyone, and then someone gets promoted and you see their name in an email and like, oh my gosh, I didn't know you worked here. So it's a lot of fun. We do have a good culture and a good place to work. So I'm excited for y'all to learn a little bit more about that also when we get to the end of this.
I was not a nursing major either. I was an accounting major. So talk about both far extremes there. But in my current role, I get to include business and nursing. So it makes it a lot of fun. So what we're going to talk about, clinical readiness. So whenever you go into practice, a lot of the conversations that we're having or counseling conversations aren't about what you don't know. We expect whenever you come into your profession, whatever that is, if it's healthcare, if it's business, kinesiology, you're going to be new, right? You're not going to be an expert. There's nursing theory that really looks at that expansion from novice to expert. And that's not what we expect for you, but we do expect you to be professional and be nice to one another and to communicate appropriately and to work as a team. And sometimes the challenges with whenever students are coming out of school into the professional workplace is, how do I communicate effectively? What is the expectation for me as a professional now? How do I handle stress? Handling stress as a professional and as a student can be different. And we personally, as an organization, we invest heavily in our new hires, whether that be in our accounting department, our facilities department, our nursing department. We invest a lot of orientation and time and knowledge into you because we want you to be successful. You're uncertain when you start a new career, and we want you to feel confident. We want you to have the skills. We want you to have the voice at your workplace. And so that's something that we really strive for. In that first 6 to 12 months, you really can create your professional presence and the reputation that you'll have in your career. So whenever I talk about professionalism, that doesn't mean you're not going to make mistakes. We're all human. I don't know one person that has not made a mistake in their personal life or in their career. But it really talks about how do you respond to that when things don't go the way that you expect them to go, or they go the wrong direction. I'm going to share a little story about myself. I'm going to be really vulnerable with you guys. A time in my career I did not act professionally. And how I overcame that. So whenever I was a newer nurse, I've probably been a nurse about 3 years. I worked as a charge nurse on my unit. I was seen as an informal leader with my team. People really looked to me. Well, there was another department that was very short-staffed. They were having a hard time filling the schedule to take care of our patients and our community. And so they had to do a very focused financial incentive in that department to help staff that unit. And that's not something that I ever would have thought about. It wasn't my department. I was there to take care of my patients, work with my team. I had a really great team. We were very well staffed, and it's not something that I would have really ever focused on. But several of my teammates became fixated with it and frustrated because that same opportunity wasn't given in our department, even though we had the resources, we had the staff. And so they became pretty negative and vocal and really pulled other people into that. And I was pulled into that. I'm not proud of that moment. I was seen as a leader, and so people followed me as I went down that pathway. And I was pulled into the office by my director, had a good talking to about professionalism and how I should be acting and the expectation from me. And really the message was that they were disappointed in how I had responded to that in managing that situation. And they were right. I didn't respond appropriately. And that was a wake-up call for me of how I wanted to be seen by my peers, how I wanted to be seen by my leaders, and how I was going to strive for excellence moving forward. As you can see, I didn't get fired. It didn't inhibit my growth within Hendrick. But it was something that I had to overcome in my career, and it taught me a very valuable lesson. So really owning your mistakes, making sure that you admit to them, you don't try to resolve them quietly, but you have relationships with your team members that y'all can work through them together. Does anybody know what I mean when I say emotional intelligence on that?
Read the room and other people's emotions.
Your own emotions as well as other people. That's a perfect example. How you manage how you're feeling, your outward expression. Emotional intelligence is really about people. And most of the professions, if not all that y'all listed, you have to work with people, right? And so you have to be able to have some social awareness and emotional intelligence so you can anticipate the conversations or the questions or the reactions of those around you. So what you will be evaluated on whenever you are a professional, the easiest things that you can do is show up on time, right? Every organization has a attendance policy, how many times you can call in or how late you can be. Present yourself. I'll use scrubs as an example. If your scrubs look like they were wadded up in the corner of the room and you put them on and came to work, your hair's disheveled, that's not presenting yourself in a professional manner. So making sure that you put your best foot forward all the time, that you are professional in your interactions. We all have bad days, but that's part of that emotional awareness, emotional intelligence, being able to recognize that, check your attitude and your behavior at the door, and being able to have those professional interactions with your coworkers. So whenever you get into the workplace, it's not just about your GPA. I am anybody that I work with, they will tell you, I don't like red. I'm a straight A student. I was one of those overachievers, but you know what? When I became a nurse, not one person ever asked me what my GPA was at all. They looked at how I acted professionally, how I interacted with my patients, how I critically thought, how I cared for my patients. It was never about my GPA. So really, that's a piece of it, right? If you aren't passing school, you're probably not absorbing the information to be able to take into your career. But also looking for, are you coachable? If you're not doing something right, are you receptive to feedback whenever I come talk to you about it? Do you take that and change your practice and improve your skills based on that? Are you reliable? Do you show up when you say you're going to show up? Do you show up for your team if they need help? Are you one of those people that they don't even have to ask? You're just there and willing to pitch in. Do you communicate effectively and positively and build strong relationships with your peers? And then also how you present yourself with that professional appearance. Being career ready means that you really understand that you have entered into a profession. It's not just a job. So this is geared towards our nursing majors. Whenever you are interviewing for, and even other majors, it won't be a nursing residency, but if there's some kind of program to help with transition of care, nursing residency programs really focus on that. Going from that student mindset to that professional mindset. It provides an opportunity to give you mentorship outside of your typical orientation with your preceptor. It's a safe space to ask questions. So I really encourage you guys that are nursing, when you start interviewing with employers, that's a question that you ask about. What is do you have a nurse residency? What does it look like? How long is it? What resources are provided? Because it can really make a difference in your transition process. Do we have any athletes? Yes. Even for fun, not. I didn't play any college sports, but I love sports. And Tony's like a sport photographer. She does amazing photos. But I love sports. I love any kind of sport. My kids play sports. I'm that mom that has the soccer shirt for soccer games, the basketball shirt for, I have all the sports shirts. Well, any job that you go into is going to be a team sport. Most jobs you have to have relationships and you have to build collaborative partnerships with someone. Even if you work in an office by yourself, there's going to be someone you have to depend on the other line. And so really connecting with people and making sure that you have someone that you can go to if you need something, that makes a huge difference. If you put up walls, you're going to need that person at some point in your career. And so really striving to bring those walls down. Does anyone, I might be showing my age in this room, but does anyone know who Justin Wren is? No. Okay. Do you know who Justin Wren is? Well, I'll just say I fangirl Justin Wren this week, but he is a former UFC heavyweight fighter. He is also the founder of the nonprofit Fight for the Forgotten that gives resources to the Pygmy people in Congo and Uganda. He really has an incredible testimony and story that he shares. I've seen him speak multiple times, and I got to see him and actually meet him this week, so I got a picture. But one thing that he said this week at a conference that really resonated with me and I thought was very applicable for this was, if you want to build trust, you have to be trustworthy. And I think that's important. I mean, it's very, very important in healthcare, as we are, people put their lives and literally put their lives in our hands every single day. But you have to be somebody that people want to come to, that people trust, if you want to have that mutual relationship. Don't go Google him. He's pretty cool. So nurses, it's not about, say nurses, any new profession. It's not about the quietest or loudest. It's really about that relationship building, that coachable, asking questions, making sure that you have a safe practice in anything that you do. You have to be able to advocate for yourself, and you have to be able to advocate for either your patients or your consumer or your customer or your team. You have to have a voice for what is right. And so you really show those leadership skills through that, being a strong team. This is really about the communication and the importance of communication in the healthcare field. We have what's called sentinel events. Those are big events that happen that cause harm. They either cause harm or they cause death. And so whenever a healthcare organization is a CNO, you don't ever want to hear that your organization had a sentinel event. But most sentinel events happen because of communication breakdown. And so communication is going to be so important in any career that you go into. Healthcare specifically, you have to be able to communicate effectively, and you have to be able to communicate clearly. And so there, as in most industries, there are tools that you can, standardized tools. It's not about being a robot. AI is really big right now. You can look up anything in AI, but really having standardized processes. Like airlines, let's talk about airlines. Their mistake rate is very, very slim, right? If they make a mistake, people are probably not going to survive, right? So they have a lot of safety measures in place. Healthcare is the same way. There's lots of safety mechanisms, but there's standardized processes to ensure that safety, because like we talked about earlier, we're all human. We all make mistakes, and so there has to be systems in place to help protect those around you. I can't preach this enough about engagement. Get involved with whatever job you are in, whatever field you go into, have your voice known. With nursing specifically, engagement, that's another question I would ask in interviews is, do you have professional practice committees, formerly known as shared governance? It is a platform where you have a voice at the bedside and you can advocate for processes. I have not been at the bedside as a CNO. I haven't been at the bedside a very long time. And so my nurses do not want me changing their flow and their practices at the bedside when I don't know what the barriers are, right? Like I have to have their voice. I have to know what they're seeing every single day, what the challenges are. I just met with a group of ICU nurses this week to talk about things that what frustrate you when you come to work, what slows you down, what is inefficient, because those are the things that I need to be focused on changing, not things that I think are a problem because it's probably doesn't even resonate with them. And so really having your voice heard in whatever job that you take and making sure that there's a formal process in place wherever you go for that to happen. Whenever you start in your career, you probably will feel overwhelmed no matter what industry you go into. You're starting in a new workplace, you're with new people, you're learning different personalities, you're learning new equipment, new knowledge. So it's normal to feel overwhelmed. You have to have grace with yourself, and you also have to speak up. Silence is dangerous if you don't ask the questions. If you have a question, that probably means somebody else has the same question. And so really being that advocate. And you don't want to get burned out. You can easily get burned out in any profession that you go into if you don't have avenues to take care of yourself. So outside of the workplace, the professional workplace, what fills your cup? What do you do that helps you de-stress? Is it reading? Is it exercise? Is it travel? Whatever that is, you need to be sure and incorporate it. That's a lesson I learned way late in life. Probably the last 3 years, I've actually started doing things for me outside of the workplace. But I recommend starting that. I recommend doing that as a student too. You can't just study, study, study all the time. You have to have an avenue to relax and fill your cup back up, and so you don't drain empty. Scenarios in the health care workforce that you will face early on, and probably in other industries as well, is going to a different company or floor or team that you don't typically work with, and having to navigate quickly the environment you're in, the people you're working with, how it's best going to y'all are going to fit together. Conflicting information. You're going to get conflicting information from different people on different things, and really knowing your resources and how to ask clarifying questions and how to get to the root of what you need to be doing, whether that's a project or that's taking care of a patient or building a business plan, whatever that looks like. You have to have clear understanding of where you're going. And then conflict. You're going to have conflict in any place that you work, and you have to have good communication and conflict management skills, really listening, not to respond. That was a hard lesson for me as well. When I first started, I really was listening so I could come up with a comeback, right? Like justify what I'm talking about, but really listen to understand the other person's perspective, and then feeling unprepared. Some professional pitfalls. I really focus on a couple of things. It's not just about what comes out of your mouth. It's also about nonverbal cues. I have a tendency to make facial expressions, and so I have to be very intentional with my face, and so I don't. Otherwise, people can read exactly what I'm thinking all over. COVID was great because I had a mask. I could cover it up so my eyes get real big. But just being very intentional about those nonverbal cues, as well as we talked about that not being defensive, being receptive to feedback, don't feeding into the gossip train, really stopping it and being that leader that redirects the conversation. And then social media. Social media is so huge right now, as you all know. I'm sure, is there anybody that does not have some sort of social media account? So, y'all probably don't have Facebook. I'm a Facebook girl. I'm that age, but I can't figure out Instagram. Just be very careful. Most organizations now have a social media policy. Does Charlton have a social media?
I think as you progress, sometimes it can affect what you do.
So Hendrick has a social media policy. I'm sure most organizations that you go to, especially healthcare, are going to have social media policies, making sure that you know that, you understand it. Healthcare kind of took personally, this is my personal opinion, this is not the opinion of Hendrick, took the wrong stance with social media initially because we were like, nope, nothing can go on social media. But really, social media can help you too. It can help drive, because that's where everybody's at, right? And so really learning how you can utilize it safely and appropriately and professionally, because it can help enhance your career as well. We have some Hendrick nurses that are influencers with different brands and the nursing profession. And so it's really about what you do with it. You want to make sure that it doesn't become a platform for venting about your job or venting about customer or patient situations, because that could hurt you professionally. Like any profession, as you start, after the first 12 months, you'll start to develop that confidence and growth. You will have learned your team. You will have learned your surroundings and what's expected of you at work. You'll be working mostly independently with some question asking, and you will have built that trust with your team. I don't like to be bored. I like to continue learning and growing, and I don't want to become stagnant. A lot of people have that, and so we have conversations with our employees about their professional goals at least twice a year, formal conversations. And what do you want to see in your career? For a nurse, sometimes that means they want to become the most clinically sound nurse in their department. They want to do all of these extra training. Sometimes that means they want to go into education. Sometimes it means they want to be a CRNA. Whatever that looks like for them, it is the job of the leaders in our organization to help them achieve that goals. And how can we get them to that next level? Even if it means we're going to lose them someday in our specific department, it means you're going to retain them somewhere else within the organization because you invested in them, you believed in them, you encouraged them. You might have financially supported them through some of Tony's programs. But it's so important that you work for an organization, or that's something that you look for in your profession, is an organization that's going to invest in you. So this is really out a couple of questions about like what, this is the interactive time, so y'all can answer. What worries you about leaving the student role and transitioning into a professional role? Anything?
I would say sometimes just not having the confidence in yourself, like, oh, I did everything that was needed of me as a student, but now how do I practice that in my work field that I'm going into? And like, I think I have a question for you. Like, how did you go from being an accountant major to a nursing? Like, how did that big switch?
Weird, right? So I love math. I was a math geek in high school. And so I thought that that's what I wanted. That's the route I wanted to go. I love business. I'm very analytical. I love data. It's really not a great life changing story, but I worked for an accountant that he wasn't the best. And so it really skewed my perception of that career. And so I took time off of school. I left school for a while, did a few different things to try to find myself and grow. And then I went back as a non-traditional student a little later. And I chose nursing because I wanted to be a labor and delivery nurse. And I got to be in the room with my best friend, Hunter Baby. And that's what I was going to do. And then I got into nursing and I was like, I don't want anything to do with that. I did clinicals there and I was like, this is not for me. And I fell in love with cardiac nursing and geriatric nursing. And that's what I ended up doing, was being a cardiac nurse. But so my story is a little crooked pathway. But each of you will have that story as well. And if you do change your major, that's okay. It took me a while to figure out what I wanted to do with my life. And now I've had a really great profession. So
Thank you for sharing that.
yeah. Do you have a question?
I'm not technically in nursing school yet. I'm still a freshman, but I still wanted to attend just to kind of see what my life could possibly be like. How did you what would you say to be successful in nursing prior to actually being in the field?
Like during nursing school?
Yes, ma'am.
It's hard. Nursing school is really hard. It's probably the hardest thing I ever did. But I think having knowing that it's not going to be an easy 2 years, but it's only 2 years, right? Like you just have to get through to the other side, and that's with any degree. I think sometimes in the moment it can feel very overwhelming, and how am I going to get to the next semester? And you just have to take it moment by moment. I'm actually glutton for punishment. I'm back at school right now, and so I'm telling myself this as I'm telling it to you, is that it's going to be over eventually. But also having those stress relievers, like you have to have something that is not school related, is not profession related, that you do, because if you continually go, and you never stop and pour back into yourself, it's harder to keep that traction. You have anything to add to that?
Yeah, I mean, I think kind of like she's saying, if you don't find something that brings like the positive energy, like, I mean, I played sports. When I got to my very first job, y'all, I was the same. Like, how did I get this job? What did I tell them that made them think I could do this job? What the world am I doing? But a friend of mine was like, hey, do you want to come play on a co-ed softball team that was going on, I think through like the YMCA or something? And I was like, sure, I've never played softball a day in my life. But it wasn't even about that particular sport. I was a volleyball player, like softball. We don't hold things. Like I was like, what am I supposed to do with all this stuff? But it was fun to be around the humans, really was what it was for me. And a guy at the time he was a weatherman at one of the news stations in Abilene, and he brings me this little piece of paper, like it was a news clipping. And he goes, I brought this for you. This is you. And I was like, what is that? And I look at it and it's the Peanuts comic strip, and it's Lucy out in the outfield with a lawn chair and an umbrella. And he's like, this is you. I was like, oh, right. Yeah, I'm totally not helpful when it comes to the team. But that was the thing that I did that it had absolutely nothing to do with work. It was something that was just kind of fun. Like the more you can laugh, the more you can, you know what I mean, enjoy being around humans. I think that's where that filling your cup back up. That's why I do the sports photography now. I take pictures for the schools, It's a lot of fun for me because it has nothing to do with anything else I'm doing. It's fun. Then I see the kids post it on their Instagram and other things. And so, that's kind of something that brings some separate joy. So, I mean, there's that. At the same time, kind of to the other part of your question, go job shadow places. Almost everywhere in the industry that you want to be in will let you job shadow somewhere. So go look that up at some different places. We can have you job shadow at Brownwood or Abilene, either one. I can help you with that. And then go see what the job's like. Because when we were young, we picked a career because it looked nice on a piece of paper, and then we got into it and we're like, I had no idea what this was going to be. And so for you to be able to have that opportunity, your career folks can help you with that a lot, but help you guys get in there and actually see what the job looks like. Kind of like you said, labor and delivery from I'm supporting my friend's situation from actually helping get the baby out, are two very different things.
Yeah.
And so go see what it's like,
And to Tony's point, really, that's imposter syndrome, not thinking when she's talked about what did I say to get me here, not thinking that you can accomplish something. You can. You just have to set your mind to it. You have to figure it out. You have to want to do it. Thank you for bringing that up. I think job shadowing is huge. If I job shadowed an accountant before, I would have saved a whole year of money and time. So I get to still use my accounting skills in my job now, but I don't have to deal with taxes. So I think that's a great point. Great question. Anybody else have any? And then we're the nurse. What excites you besides getting out of school one day, starting a profession? Money, maybe?
Making a difference.
Yeah, making a difference. That's a good one.
Starting my life. It's money too.
That's your why, right? You make a difference. So I think knowing your why is important. Everybody's why is going to be different. And it'll probably change throughout the phases of your life as well, of why you're doing something and the goals that you set for yourself. But knowing that and keeping that in the focus, especially when things get hard and stressful and crazy and busy, that's really what becomes your guiding light. Okay, this is not.
My turn. The other thing that I will kind of comment on to the end of what Jessica just said is, so when I was in college, I played volleyball, I cheered, I was at a kind of small school. It was all exciting. And I was like, I can't wait to go be a grown-up, and I'm going to move into my own apartment. You can go to bed when I want to, I went to a Baptist school, so they were very like, curfews this time, and you had to sneak in the back door in the dorm so you didn't get in trouble. I never did that. But, I was so excited about it. And then it was probably 2 weeks before graduation, and I was like, holy crap, I have to get a job and an apartment, and I have to take care of myself, and I have to pay bills. And I think there was a little bit of panic, but that first year of working, of paying for my own apartment, y'all, I literally had a recliner that my grandmother had given me. I had a table she gave me, and I had a mattress that I didn't even have like the frame. It was like on the floor, a box spring and a mattress, and that was my whole apartment. I had 2 plastic plates I washed alternatively, lunch and dinner, like literally. And I was so proud of myself, but also terrified. But that first year, I would say more than anything, if you need help, ask for help. If you're like, gosh, I should know how to budget because I'm 22 and I have a paycheck, but you don't, and your money's disappearing, go ask some. If it's not your parents, because your parents were like, you should have your life together, fine, ask your aunt or uncle, or ask a friend's parents, or talk to someone. And if you're like, shoot, I got really sick and I didn't budget for paying $200 for a prescription at the pharmacy, ask for help. Ask the pharmacist, is there some program don't be afraid to ask for help. Nobody expects you to be here when you just started something. Does that make sense? If you get stuck at work and you're like, I know that I learned in nursing school that I'm supposed to know how to do this, and if I ask my manager, she's going to be like, oh my gosh, why did we hire you? Why don't you know this? She's not. She'd rather you ask than hurt a patient, right? So just know that asking those questions and getting help is not a detriment to you. It's actually going to help you along the way, right? And then when you get to be old like us, just kidding, she's not old, I am, then you will want to help those 22-year-olds that just came out of school, right? So just think through that and know that asking for help does not mean that you were not prepared. You are prepared. It's just that everybody's new at everything when they first started, right? That is not the right button, just kidding. Okay, so I told you guys my job is really just to kind of help create a pipeline of people into healthcare. I actually do work with our clinical staff, but also I work to help get our facilities people in and our accountants and the different people. I'm in HR. There's just lots of different areas, and so we work really hard to help people find their way into that system. We have a couple programs that help with tuition while you're in school. So we do have a pay-as-you-go for our current employees. Our career journey is for folks who are not currently employed by us, but we can help them with nursing school, medical lab tech, pharmacy, some different things like that. The goal of that is for us to help you literally pay as you go to school. So we help you with your tuition. When you graduate, then you will go through an interview process, get hired at one of the hospitals, and then you fill a commitment period. So your way to pay that back is to work for us for 2 years, 4 years, depending on what degree you go through. And so we have helped a lot of students here at Tarleton and are excited to do that. It's a lot of fun. I get to give away money, so I have the best job. If we don't do the tuition for you while you're in school, then we have a tuition reimbursement program. So once you get hired, then we basically help you kind of pay towards your student loans. That actually has a little bit more options as far as the different degree plans. So like, for example, we have social work that we will help on the tuition reimbursement side that we don't necessarily help on the front end. So there are some additional programs that we help with that. I wanted to give you kind of a little bit of an idea. That is a lot smaller than I thought it was going to be, and I can't see because I'm old, so there's also that. But our career page is that website. And this is kind of what it looks like. Basically, over there on the left, you sort of click the general area that you think you want to look for a job. So it might say professional and managerial, non-clinical. I think, again, I can't see it because I'm blind. Or it might say nursing professional. That will kind of narrow down what you're looking at. Then underneath there, you might choose the Abilene market or the Brownwood market. If you don't, it'll pull at both, and you can just kind of look and apply to both places. I actually went to school in Brownwood. I currently live in Clyde, which is right outside of Abilene. And so I've been in both places. They're both phenomenal. We have great staff and great hospitals in both places and clinics. And so I will advocate for you to go to either place. Personally, I have a nice little heart towards Brownwood because it's smaller, and I love that kind of small town, everybody knows everybody kind of feel. And it does have a lake, which we did not in college spend a lot of time at when we were supposed to in class. And it was a lot of fun. It's really nice. And so there's just a lot in both markets, but Brownwood is kind of close to my heart. It's a good place to be. So you would sort that way. And whether you decide to come to us, to Hendrick, or you go anywhere, you go back to DFW and you want to look for jobs there, don't feel like, okay, I want to be a labor and delivery nurse, and that's the only job I'm going to apply for. I would apply for anything that might be of interest to you, because we get 75 people that apply for each one of those new grad nursing jobs, right? And so we only have so many. So the more you apply for, the more you're increasing your odds. And when I talked about job shadowing, we have, Jessica talked about nurse tech. We do have some college internship jobs each semester actually, and in the summer. That not only gives you experience, but it also helps you make connections, right? So today, if you have time and Jessica has time, you might go introduce yourself to her. When we know you and we see your names, if there's 75 people that have applied for a job, and I've met you before, and you came and you did clinicals, or you came and you job shadowed, or you came and did nurse tech, is there a higher likelihood you're going to get interviewed? Right? Because I mean, a new grad, all your resumes look the same, right? I have not much experience. I worked at Chick-fil-A. Thank you. Please hire me. And we all have that when we first start. So build those relationships, get to know people, see people, meet people. I'm happy to help you with that. That's a lot of what we do, and get you connected and let you, once you're cleared to job shadow at Hendrick, you can job shadow as many times as you want and in many different areas. So she said, I wanted to be labor and delivery, and I got in there and was like, absolutely not. Then she might want to go job shadow in oncology or job shadow in the ED and just see what some of the different units are like. And so there's lots of opportunity for you guys to do that too. And that is my program's email address. You're welcome to email that. Really, honestly, even if you have zero intent, I don't want to come to Hendrick, I'm not moving to Abilene or Brownwood. If you have questions, or there are some things that you just want to know or you want some help with, we're happy to still help you, point you in a direction. We have lots of really cool programs, I think, but I can help you find those programs at another place in another town. I had a young lady that went to school with my kids. My kids go to Clyde, and so we work with their school quite a bit, and her dad was moving to Florida, so she moved to Florida with her dad, and she was like, do you think that someplace in Florida has this? And we did some research together. Like, we'll help you. We want to be as much help as you can, because let's say you do end up back in Abilene or in Brownwood or in our area, we would love for you to feel good about us and decide you want to come work for us. So, and those of you that were also thinking like kind of that advanced practice or med school or any of those kinds of things, I would also be glad to connect you with our physician recruitment team. They like to kind of talk to you early on and visit with you guys about what that long-term, plan looks like potentially to come and be, a nurse practitioner or PA or a doctor with us. And we're always recruiting awesome people. Charlton's always fun people. We love you guys. Love the country feel and all the things. My son, I really thought my third son is a senior. My third kid, anyway, I don't know. But anyway, I really thought he would come here. It was close enough, it's very country. He's my ag boy. But anyway, he's going to end up going to West Texas A&M. And so I think this is kind of his second. If that doesn't work out and he doesn't love it there, I think he's going to end up, but he has some really good friends that are here. And so, just kind of a fun, I always love coming here. It's fun to talk to you guys and to be a part of that. So what questions do you guys have for either of us? Anything that you still wanted to ask or anything at all? How's life? I'm just kidding. Yes.
How can we get plugged in with like a job shadowing opportunity with you guys?
Yes. So email me at that. Email us at that, and we'll send you the link to it. Or if you remember this, or if you want to look it up now, if you Google Hendrick Health application for clinical observation, it'll take you right to it. Mark sheet form you fill out. And once you fill that out, our education team will email you and they'll send you a packet that says, you have to get a background check, you have to get a drug screen, TB test, make sure your vaccinations are up to date. There's a little kind of education thing and a little test. It's not a hard test like y'all take now, but a test to make sure that you answer some questions. And then when all that's turned in, then you go back to our education coordinator and she will help you connect with the manager in the areas that you want to job shadow. And I've had people job shadow in facilities. I've had people job shadow really kind of everywhere, not just clinically. But we do have a lot of ability to job shadow in the clinical areas also. So yeah.
Thank you.
Yeah.
Do y'all have a prosthetics and orthotics program?
That's a you question. I don't know that.
We have ortho, so yeah, through our orthopedic surgeon office.
Okay.
Any other questions? Like what question do you have there? She's kidding. I've talked to Xerox before.
Maybe online.
Yeah? Oh, I don't know how to do that. Is it?
It's just gonna talk,
Oh.
maybe.
Anyone
Yeah.
online have questions?
There you go.
Yes, ma'am. I just want to say a little bit concerning clinical shadow that she just mentioned earlier. Is the link going to send generally or particular to the person that requested for the question?
Big person for questions.
Can I go backwards? How do I go back on this?
Just click.
Sorry,
Put
technology.
the email address back on the screen, and that's who it goes to a group of people that can respond to the question. Tony's one of them.
And then we can send that link to you.
Yeah, thank you.
And are there any other requirements to be able to shadow, like?
You just have to be 16, pass the background check and the drug test, fill out that packet, and you should go.
Okay.
If you end up you're doing nurse tech or you're about to do nurse tech. So let's say that you do get hired on, whether you're an intern with us, we'll post some summer internships actually pretty soon. That's also my job and I haven't gotten that done yet. Don't tell on anyone. On me. But if you job shadow with us and then you decide, hey, I'd like to be an intern or hey, I'd like to work as a nurse tech, when you're hired by us, you can also job shadow anywhere within the system because you're already cleared, so to speak. You know what I mean? And so while you're doing your nurse tech, if you get assigned to a certain floor, but you're like, gosh, I'd really like to see this or that. I've actually gone in toward like the lab and the pharmacy, and it's actually really fascinating. I always pictured the lab was like CIS and all the little microscopes and all the things. It doesn't look like that at all. It actually looks more like a factory with a bunch of big, huge machines that are like these conveyor belts and all this stuff. I was like very surprised. I had no idea that's what that was like. The only pharmacies I've seen are like CVS or, the pharmacy that I go to, but in the hospital, there's all kinds of, behind this wall, there's all this cold whatever. And y'all, there's tubes like at the bank that shoot stuff all over the place. Y'all, I had no idea. I told y'all I was not healthcare at all. So it's been very fascinating. So go and see it. Go get behind the doors of the hospital. The other thing that it'll do for you is if you're thinking, gosh, I would love to go work at the hospital in Brownwood. there is a little bit of, y'all might not be anxious people. I don't ever think I am, but that's probably a lie. But like the thought of going and working at this place where all I've seen is this big picture of this beautiful building in the door, but I've never been behind it. It's like anxiety provoking to think now I have to go there, and are people going to know I'm really not supposed to be here? And where do I go? And how do I find Starbucks? Because that's really all that matters. But if you get behind the doors of the hospital job shadowing or doing the nurse tech, then you start to feel familiar. You know what I mean? And it feels like a place that you could picture yourself working. So again, even if you're going into something completely different, go see if you can go to the health department, you know what I mean? And go do some job shadowing there and see if they'll let you do that. And most places really will, or give you a tour. That's a good way to kind of get that going in a different language. But just get behind the doors and see what it's like. Meet the people, see what the people are like. I've worked in jobs where I loved everybody I worked with, and I've worked in jobs where I was like, these are not my humans, and I need to find somewhere else to be. I worked part-time when I was in college, different jobs, and then right after, my first job didn't help pay my apartment, so I had to work a part-time job. But I worked at Dillard's first. Y'all, I am not a pantyhose and the suit kind of thing. That was not my life. So then I started working at Old Navy, and they're like dancing in the little, aisles while I was like, these are my people. And so I worked at Old Navy instead of Dillard's because it was just a different environment for me. But you have to try places on and see what they're like so that you can find what fits for you. I will tell you this. If you get into a job and you're nervous about going in, or you're not sure, usually it takes 6 to 9 months to even figure out what you're doing when you walk in the door, about a year before you feel comfortable. But if you get to a point after that period of time where you're dreading going into work every day, it's time for you to start find another job first. Don't just quit. But it's time for you to start looking for something else, because your life and your health and your mental well-being is way more important than the job I think I'm supposed to have.
And it doesn't necessarily mean you have to leave the organization.
Right.
So I'll just use this as an example. We have 3 different campuses. They all have different specialties. So maybe you just want a different environment, or if you're an accountant in Brownwood and you want to go be an accountant at the Abilene campus, it doesn't mean you have to change the organization to change wherever that is.
100%.
And maybe it does. Maybe it means you do need to.
You guys have any other questions for us? Yeah, we appreciate it so much.
Well, thank you guys so much for coming and sharing all of your information and your perspectives on career readiness and healthcare. And I hope you guys got as much out of it as I did just from listening in the back. And hopefully you'll reach out and connect with them for any questions that you have, and take advantage of those job shadow opportunities. We're going to be working in our office to provide a lot more of those connections for you in the future, but that is gold. When you're able to go in and, like she said, try those things on, because you don't want to get into a whole career and then decide it's not for you. Use these opportunities where you can spend a day, spend a couple days, and then see, maybe you thought your whole life you wanted to be something, and then you get in that environment and it's really not for you. And that's okay. You just don't know what you don't know. So take those chances when you can. So thank you both so much for coming and joining us today, and we'll give them all a round of applause.
Thank you.
I'll probably agree with that, yeah.